Okay, hi everyone, welcome. First and foremost, congratulations if any of you are expecting. It's a very exciting time in your life. As I've forgotten your name, this lovely lady just said, Jess. My name's Brooke Caruana. So I'm a registered nurse and I'm a midwife. I'm also studying medical science at the moment, and I'm specialising in pathology because I'm very committed to this area of science, which is stem cells. So I've got 20 minutes to have a little chat with you. At the end of that time, because I'm the last presenter, we will be able to have a few questions. So if you've anything at all you'd like to ask me, please do. So what I'm going to do is just go through some really basic information about stem cells, why people are choosing to store their stem cells today, and just a little bit more detail about the actual stem cells from the blood and from the tissue. So, first and foremost, what is cord blood and what is cord tissue? So when your baby's born, the cord, the placenta and the umbilical cord, which is attached to your bub, is very rich in stem cells. So there's a lot of blood left over in the cord and the placenta, and it's very, very rich in stem cells. Stem cells are being used today for medical treatments. So number one, it's the blood that remains in the cord, as I just said, and it's very rich in stem cells. And the tissue itself is the actual umbilical cord tissue. So it's the cord. And that's very rich in stem cells as well, but it's a different type of stem cell from the blood. So it's a procedure that people choose to do where they have the blood collected and also, and sometimes both, the tissue as well, collected and stored in a blood bank. So it's similar to when you go and donate blood to the Red Cross or wherever, the Red Cross, and if it's still called that, and it's stored. It's a similar sort of procedure to that you are able to use it, okay? It's very safe, it's very simple, and it's completely painless. Once your baby's born, generally bub gets put on mum's chest. When your placenta is still inside your uterus, they just pop a little needle down the bottom of the actual cord and drain the cord blood. So there's no feeling whatsoever, very simple, very safe. And a lot of the time mum she's not even aware, or dad, because they're very excited about bub. So it's simple, safe and painless. You can do it at a vaginal birth or a caesarean birth. You can do it at a home birth or a hospital. You can have it done anywhere at all. And often the obstetricians collect. We also have trained collectors, like lovely Belinda over there. She's a midwife and a trained collector. She goes to a lot of births. So it's a real treat for us as well to be able to go to those births. And sometimes the midwives collect as well. Just depends where. So why? That's the question, I suppose. You're all wondering, well, why would you do it? And the reason you would do it is because stem cells are used today for medical treatments. So most people have heard of a bone marrow transplant where they're harvesting stem cells for use. You wouldn't have to have that if you have stem cells ready and already stored, okay? So there's a number of different conditions, and this slide here just gives you an indication. There's so many of them, I won't go into detail. Still predominantly things like bone marrow cancers and leukemias and solid tumours, anemias, lymphomas, and lots of other areas. So there's also, basically there's three main reasons. One is that it's a perfect match to your baby as well. So your baby's cord blood is 100% matched to your baby. It's very, very worthwhile for storing for siblings, because lots of times siblings are the first person you will go to if you need a stem cell transplant and you don't have any cord blood stored. And number three, there's an enormous amount of growing evidence that demonstrates the benefits of cord blood, the immunomodulatory properties, not just the stem cells themselves, but also other properties in the cord blood that play a really big role with certain conditions, autoimmune processes and conditions as well. And that third area is the research. The research is enormous in lots of different areas for the future as well. So, as I said, your baby's stem cells are a perfect match for your baby because you always need to get a match. There's no waiting time, it's ready. You don't have to go and have an invasive procedure to have a stem cell transplant, and it's a greater potential to match siblings than any other family members. And we also know that a mismatch from a sibling can be very beneficial as well. And you can't have a mismatch from someone you're not related to. So, and I can talk a little bit more in detail, but I won't unless you've got any questions about that. So, very, very beneficial. What does the future bring? Two very big clinical trials at the moment, one at Westmead Children's Hospital for type 1 diabetes and one for cerebral palsy with the Murdoch Institute and the Cerebral Palsy Alliance. So with the type 1 diabetes trial at Westmead Kids, Associate Professor Maria Craig believes that by reinfusing children who we know are in the process of developing type 1 diabetes, that cord blood may be able to prevent the onset, and that's because of the properties of the cord blood. It can help stop the process that's destroying the baby's cells that produce insulin. So that's a very exciting trial, and we've actually had our first little girl, 4-year-old Isla, has been infused with her own cord blood, and she's progressing very, very well at the moment. So she's still without type 1 diabetes. The second trial, the cerebral palsy trial, what we know already from global evidence is that by reinfusing children with CP with their own cord blood, we're seeing improvements in their cognitive ability and in their gross motor skills. So that's an enormous impact for families that have children with type 1 diabetes with cerebral palsy. The trial in Melbourne at the moment is in the phase right now of typing. It's a sibling trial. So what they're doing is they're collecting the cord blood from the baby and infusing it into the baby's sibling who has cerebral palsy. So that process is underway right now. So that's cerebral palsy and type 1 diabetes. There's lots of other enormous amount of trials going on globally as well. Very, very big areas like CP, HIE, as you can see, autism, neonatal stroke's a very big area, and so is the hypoplastic left heart syndrome, as well as wound repair. Enormous things going on with wound repair. The tissue sees a lot of regenerative research taking place. Rheumatoid arthritis, lupus, heart disease, bone repair, stroke, the list goes on. It's very important to us. We're very heavily regulated in Australia, and that's because we want the best outcomes when it comes to research. So it's very important to us as a company that we are able to keep up and provide, interventions and treatments that are approved and safe. Unfortunately, what we do now is that at the moment there are people going overseas regularly to have stem cell treatments. We want to be able to provide that here in a regulated and a very safe environment. So, what do you know? You know from this talk, hopefully, that the blood and the tissue is very rich in stem cells. There are two different types of stem cells in the blood and in the tissue, and that's why we collect both. We know that they're now being used for medical treatments, and we know that there's new therapies being approved all the time. Between a 4-year period of, I think, about 2008 and 2012, there are an estimated 50 new areas of treatment approved through the TGA. So it's a very, very big area. A lot of growth taking place. And what we know is that your baby's stem cells are a perfect match for your baby, and likely to be a very good match for your baby's sibling as well. If you want to know how much it costs, it ranges from, most people will pay according to what suits them, but it can be as little as $79 a month. We have a lot of monthly plans so people can have access and make it affordable for them. Other people will pay a one-off amount of $3,000 for 25 years storage. Now, in saying that, guys, nothing at all is done until after the baby's born and until after we know that you can store that. Before that, you just have a small registration fee and you get your kit. We're a very big company. We've got a very big customer service team that talks regularly with all the mums and dads. They get very excited when the new babies are born. We all do. And they regularly keep in contact with you and let you know what to do. We have our own 24/7 labour line that you ring as well. In regard to the likelihood of use, and this is conservative, but it's based on releases worldwide. For child stem cell therapy, it's about 1 in 3,000, and over a lifetime, would you believe, 1 in 200. So as we get older, there are far more conditions that we may have where we would use stem cells. Things like lymphoma, multiple myeloma. You've probably heard of a lot of talk about MS. That's not approved at the moment, but there's lots of different areas. Can be stored, at the moment we store for up to 25 years, and we know in Australia, the evidence shows us that it's now being stored up until the 23-year mark, and it's still viable at that point. Overseas, it's much longer. You would be silly not to continue to store after that point for a very, very small fee, because with research taking place, it'll be amazing by that point in time. And a lot of it is regenerative, like I said. So can I donate? That's a question that comes up all the time. We're very, very pro-donation. It's a fantastic, very altruistic thing to do. And there's only 4 hospitals in Sydney, though, where you can donate. So unless you're birthing or having your baby in any of those 4 hospitals, you don't have the option to donate. You only have the option to store privately. Those hospitals are, because everybody always asks that, St George Public and Private, Royal Prince Alfred, and the Royal Hospital for Women. And would you believe, when I was doing my midwifery, I won't tell you how long ago that was, it was a long time ago, they were actually doing the research into cord blood then. There was no approved therapies, that's a hint, but I was working in labour ward and heavily pregnant, going for a walk down memory lane, and they were knocking on the door, and very crudely, they'd take the cord blood back then, so we've come a long way. And that's when they were just doing the research. Today now, there's 81 indications for use, so that's how far we've come. But you can donate it, limited hospitals, it must be during working hours, and that donor bank is a global donor bank. So it's there for, it's available worldwide. I told you how long we can store it for, and there's an Expo offer on today, which is an upgrade, 7 years, so you would pay for 18, and of course you'd get 25 years. So that's about it. As people know who visited the stand, I can talk all day long about stem cells. But does anyone have any questions? Is there anything specific? Because I do get a lot of questions. Yes? Yes. You do. So this... Yes. So this lady's just asked if you can store after the 25-year mark. So currently, yes, you pay for a 25-year period of time, and then after that point, it actually becomes your child's property. At 18, your child will be notified and told that, or your adult child will be notified and told that it's their property. And at the 25-year mark, they will have the option to continue to store, yes. So they would just make a very small payment on then and continue to store. Does that answer your question? Yeah, thank you. So, yeah, any other questions, guys? Have you heard anything in particular about it that you have a query with? No? All right. Well, have a fabulous day. Thank you very much for coming. I've got lollies on the stand if you want to come and see me. And, yeah, take care. Thank you.